So in our previous video, we talked about what epilepsy was, and we said that epilepsy is a case where a person has two or more seizures, which happen over a couple of days, weeks, or months, or they keep having frequent seizures, and the cause in this case is unknown. So in these patients, it commonly runs in the family. That is why when someone has a seizure and you go to the hospital, they always ask, do you have anyone in the family who has seizures? Because it runs in the family. So what else can cause seizures? This applies to someone who has epilepsy or someone who doesn't have epilepsy. What can cause a seizure? So one, alcohol. So people who spend a Friday night and you drink 10 bottles of alcohol, you drink too much, you can have a seizure. And then people who are alcohol dependent, the people who shake when they don't drink alcohol, sometimes they can have seizures also. So drugs like cocaine, heroin, if you take too much of those drugs, you can have a seizure. Hunger, if you haven't eaten and you're very, very hungry, you can also have a seizure, right? So if you're dehydrated, you haven't drunk water for a very long time, you're very, very dehydrated, you can also have a seizure. So sleep deprivation, if you don't sleep, you spend 2 or 3 days, you haven't slept, you can have a seizure. Okay, so flashing lights, this is mostly important for people who have epilepsy. So if you're exposed to flashing lights, you can also have a seizure. That is for people who have epilepsy. Not so common in people who don't have epilepsy. Okay, things like tumors. If you have a tumor in the brain, you can have a seizure, right? If you have trauma, you're involved in a car accident, you hit your head, you have some bleeding in the brain, you can have a seizure because of that trauma to the head. Okay, things like infections. If you have things like meningitis, which is an infection in the brain, or you have pus in the brain, any infection in the brain can cause a seizure. For children, especially children less than 6 months, fever is actually more than 6 months, I mean. Fever is one of the most common causes of seizures in children. Okay, that is why every time your child has a fever, go to the hospital. Okay, because they can have a seizure just because they have fever. Okay, so these are some of the causes of seizures. So be on the lookout. If you have epilepsy, uh, try to avoid some of these causes that we've talked about today because they can increase the chances of you having seizures. If you don't have epilepsy, well and good. Also, try to reduce some of these risks so that you don't have a seizure.